All right, now we're going to do a plantar glide of the medial column, stabilizing the calcaneus and talus, starting with talonavicular mobs, working our way down. You can use the flat edge of a wedge, sometimes actually even using like a dowel rod that's been cut, or even a larger battery to stabilize underneath can work very well. We're going to show the wedge because most PT clinics have that. And one reason we're using the wedge is to allow the forefoot to be able to rest over the top. It's usually a bit more comfortable to have your hand underneath or your finger, or you can use the edge of the wedge. You may need to elevate the end of the table to get the foot in a bit more neutral, not excessive ankle plantar flexion. Okay, so I've hooked there right under the talar head, just barely proximal to that navicular, and applying a glide, a rotation, or a thrust. All right, working the way down, stabilizing the navicular. Now adjusting the medial cuneiform on navicular. Glide, rotate, or thrust. Noticing these are mainly plantar glides. We can flip it over and do a dorsal. And then we can also flip the wedge over. Especially as we get more towards the distal aspect of the foot, it's a bit easier to flip the wedge over. Really make sure you're in the joint plane there. Kind of wiggle it with your digits. And then grab thenar for more force. All right. So now if you want to apply more of a dorsal glide, prone's a bit easier. Imagine you got a sublux lateral column here, a cuboid in particular. And we're going to drive that dorsally. Stabilizing the talus there on the edge of that wedge, a towel to soften it up a bit, depending on whether you have the firm wedge, which is the blue. The black's actually a little bit softer, so some of these are a bit more comfortable with the softer wedges. Getting the limb in a comfortable position. Respecting the joint plane of the cuboid and the ankle. Thumb to thumb pressure is better. Just to apply more force, this requires quite a bit of force. To make sure you're on the cuboid, just slide right off that fifth mitt. Oftentimes it's tender right there. You can just check for tenderness. Little bit of inversion. Because remember, a lot of times we're trying to get that cuboid to lock better into supination. So a little bit of supination, but respecting the lateral ligaments of the ankle. That's one reason you have the wedge. That actually prevents excessive plantar flexion. If the wedge wasn't there, the ankle would be on the table. And you can just do grade 3, 4 to 5 manipulation here. All right. Now, if they have plenty of ankle plantar flexion and they have no resistance to that at all, you can use something like this. All right. And apply a bit more force. All right, so now we're going to move over to the medial column, just medial to that cuboid and a bit distal if you want to hit the cuneiforms, a bit more purely medial if you want to hit the navicular. Again, so if it's plantarly subluxed and we want a dorsal glide. Usually this is to restore a bit of supination in general for a hyperpronated foot. Okay, so the cuboid takes up essentially the lateral half of the foot. So if you're on the medial half of the foot, you know that you're not on the cuboid. You walk your way over from the cuboid. Remember, the fifth ray is your landmark. And then you're on the navicular. If you go just distal to that, you're on the cuneiforms. The procedure is very similar. Trying to help supinate. Remember, a lot of the supination I'm trying to get a bit in the midfoot, not just in the ankle. So essentially you could think of it as, there we go, same whip as before. I'm working my way bit more over to the navicular to try to make sure I have a little bit more bony contact. A lot of soft tissue tenderness sometimes in the abductor hallucis, excuse me. Feeling for that mid-tarsal rotation.